Dear friends, we are happy to meet you once again. Saturday, 26 April 2025. We have finished 1558 cases of Puberphonia. Now we are planning for more work in the name of Puberphonia, humor therapy, research work. We want to prove EULA is a speech organ. It is not only a auxiliary speech organ, it is a main speech organ for male. Female, the main speech organ is vocal cord and its structures in the larynx. In female, it is like that. In male, it is the uvula, and uvular complex is the structure for producing a low pitch. So we are analyzing as much as papers, write-ups available about Puberphonia and making it as a record from the introduction of Puberphonia. What is when it was found out, what causes for it, a overview, and what is the significance of Puberphonia. It is a very big job we are planning to do it to a great extent. What more we can do for Puberphonia? It is called as a mutational falsetto, which is a voice disorder where the individual, the primary, it occurs in male, and the voice will be high pitch, and the high pitch voice continue even in pre-pubertal voice after puberty, which is inappropriate to the male. And persistent of high pitch voice is a significant because it can impact communication, social interaction, and overall quality of life. So it is very clear from the introduction. I want to tell it is only a functional voice disorder, meaning it is not caused by structural damage to the vocal fold, but rather by inappropriate vocal habit. It is characterized by habitual use of high pitch voice with inappropriate for the individual's age and gender. This voice may be sound breathy, rough, or lacking of power. What is more common in male? Yes, male can also, it can occur, Puberphonia can occur in female also, but it is less frequent, may be referred as juvenile response in order to recognize the girl, or it is a little girl's voice. The importance of Puberphonia, why Puberphonia is significant today, everybody should understand. Impact in communication. A high-pitched voice can make it difficult for individual to understand, and he is perceived as unauthoritative in professional and social settings. That is the impact on communication. Those who are having a female voice in a male, they are perceived as unauthenticative in profession and social setting. It may look simple, but this communication make him a powerless gentleman. So this creates a great social stigma. Individuals with puberphonia may experience teasing or social isolation due to their altered voice. So it is a great social stigma, and their quality of life will be very pathetic. Puberphonia can affect an individual's self-esteem, social confidence, and overall quality of life. That everybody should understand. Definitely, all over the world, they say the priority of treatment is only voice therapy because it is not due to any change in the phonatory apparatus, in the vocal cord. Everything is normal. So, a training in voice which should be focused on teaching individuals to use their vocal mechanism in a more appropriate way. Definitely, all over the world, good treatment are available, but it is not so popularized because it is not tailored for each individual. So there is a limitation for it, for the traditional approaches and common treatments. So the traditional approaches to treat puberphonia, a functional voice disorder, primarily involves voice therapy, voice exercise, and psychological counseling. These treatments aim to reduce the pitch of the voice and address any underlying psychological factors. Where generally effective, there are limitations. And in rare cases, if they are not able to achieve a good low pitch voice, surgical intervention may be considered. So the primary treatment is voice therapy, involving the exercise in lowering the pitch and improve voice control. Overall, the traditional approach is psychological counseling. Addressing any psychological factor that may be contributing to the disorder is crucial. This can involve identifying and managing stress, anxiety, and other underlying issues. But there are a lot of limitation of the traditional treatment available. That is why some of the treatments are, or all the treatment are not famous throughout the world. Number one, voice therapy requires a constant practice and dedication, which may be challenging for some individuals. Definitely, individual variability will be there. The effectiveness of voice therapy depending upon the individual's motivation, underlying cause, and the severity of the disorder. Some patients may not adhere to the prescribed therapy regime, leading to less successful outcome. Moreover, if a psychological factor is not addressed effectively, this disorder may be more difficult to resolve. That is why more surgical treatment had come for treatment of puberphonia. Yes, surgery for puberphonia is also available throughout the world. It involves shortening and relaxing of the vocal cord, thereby the lowering the pitch. It is generally reserved for cases where conservative treatment options have failed. Surgery in the vocal cord, Puberphonia, ECT method, involves shortening and relaxing of the vocal cord. Vocal cords are normal, but we are trying once again to get a lower pitch. Why not we involve by doing a shortening and relaxing of the vocal cord? Fortunately, some people with surgery immediately they are having good voice. So, what is the cause for it? Normal vocal cord, by doing a surgery, they shorten and relax the vocal cord. Thereby, the voice is lowered. So, what is the cause for it? We personally feel the laryngeal voice is shifted from the larynx to the pharynx. So, a thorough understanding of the voice production in laryngeal, pharyngeal speech and role of uvula and the pharyngeal region, what is the thing we should know? The important factor, there are many reports that a patient can have a normal speech by pharyngeal mechanism. There are many type of laryngeal speech available. It may be esophageal speech or buccal speech or a nasal speech or whistling of the speech or speech with artifacts. But we are interested, we are treating, we have treated 1,558 cases of puberphonia by converting the laryngeal speech into pharyngeal speech. This therapy, we are doing it for the last so many years. But we had cases, we had interesting reports. There was a report. The finding is a 12 years girl who was suffering from laryngeal papillomatosis. Because in laryngeal papillomatosis, very difficult to relieve. Surgical option is available. Even we have operated more than 15 times in the vocal cord. But this girl developed her own pharyngeal speech. That is the exclusive method of oral communication since the age of 2. So we are seeing the girl from second year to 12th year. Papillomatosis recurring even after surgery. But this girl had a normal speech. Papilloma was there in the vocal cord. We are rooming, we are insulting the vocal cord, we are damaging the vocal cord, whatever may be. This girl continued to have a normal speech. That speech, he developed exclusively for oral communication since the age of 2, the pharyngeal speech. So it is a unique physiological mechanism that pharyngeal speech are described and different from other forms of alaryngeal speech. So the intelligibility of the speech is good. She had a good phonation time and maximum phonation time, and the frequency is also good. So this had given a good idea. Definitely, if we continuously practice pharyngeal speech, we'll have a very good normal speech. But our experience of seeing 1,558 cases, most of the cases report to us the social challenge. That is what they had come for treatment. The impact of social relationship and family dynamics, and the social pressure in puberphonia. How voice change can impact a boy's sense of self, social perception, and peer pressure. So, what is the expectation of the family? What is the expectation of him? What is the expectation of peers? There are a lot of confusion and identifying questioning associated with puberphonia. That will affect a puberphonia boy's self-perception. That will cause emotional and psychological impact. So all try to understand the voice only produce emotional and psychological impact. The psychological impact or emotional feeling doesn't cause puberphonia because of puberphonia voice, because of the social perception of the voice, because of the peer pressure, because of having a puberphonia voice. There is a lot of impact on social relationship with puberphonic voice. So it is really a pathetic condition. There is a confusion in his mind associated with puberphonia. Emotional and psychological impact. So this emotion makes him isolation and confusion. Navigating social dynamics, strategies for building a positive self-image. That is what we are telling, the importance of early intervention. How early treatment can mitigate the severe consequences. This is encouraging a open discussion and reduce stigma. Very, very, very important thing. We are dealing with a poor puberphonia boys. So early intervention is required. So early supportive system should be available with resources. Highlighting available supporting system for affected individuals. How the family friend and professional help available. It raised the awareness and encourage better support for these affected. Definitely, the role of family, friend, and supportive network definitely is needed. That only create a acceptance. How family, friends, and the professionals encourage a better support for those affected, and the affected boys will get early treatment. That is why we are going on suggesting when the boy feel the adults perception of the voice is female, mostly in phone call. If it is repeatedly happening, they will get upset. So this prompts us that every Puberphonia boy, they should be recognized early and treated. So a great social support should be available. So that is what significance. That is what we feel that traditional approaches fails. So we are introducing a new type of treatment called as UMAR, uvula manipulation and resonance. Make a or a transform a laryngeal speech to pharyngeal speech. Instead of vibrating the vocal cord, you can vibrate the uvular complex. Definitely, the voice produced at the level of the pharynx will be low pitch. Definitely, it is modulated by the same mechanism by the tongue, lips, and resonated at the nasal cavity. The beauty is normal functioning vocal cord is there, but that is not working properly. So in Puberphonia boys, if you create a laryngeal speech by pharyngeal speech, the voice will become low pitch, a manly voice, as well as he is having a normal vocal cord. Definitely, early and permanently, he will have a normal, good voice. That is what our aim. So we are happy on this Saturday, 26th April 2025. We have finished 1,558 cases of Puberphonia. This is a great number for us. Still, many boys are coming and consulting us. We pray God that we will do good service to the community. Puberphonia treatment not only change the voice, it changes the life of the boy. So a happy day. See you next Saturday, same time, 5 to 5:30. Thank you. Great, great, great.